Washington, D.C. is using public health tools to not only fight the pandemic, but gun violence as well. In January of this year, the city hired its first gun violence prevention director, and it opened an emergency operations center, and it launched a new initiative called Building Blocks. The program targets 151 blocks that account for 41% of last year's gun violence. Amanda Michelle Gomez, a reporter with Kaiser Health News, took an in-depth look at the city's initiative, and she joins us now. Thank you so much for being here, Amanda, and good morning to you. So we're looking at new research, and it shows that gun violence in the U.S. increased 30% during the COVID-19 pandemic. So what is behind this spike exactly?
Thanks for having me to talk about this really important issue. So gun violence, as you said, is up, and also the worst manifestation of that violence, murders. In speaking with experts from police to criminologists, no one could point to one single issue as being the source of the violence. The DC's first ever gun violence prevention director, Linda Harley Harper, and I spoke about what might be behind this recent trend in DC. Last year, we experienced a 16-year high. And she said that, it's a combination of a lot of things. People experiencing a lack of opportunity and hopelessness, perhaps substance misuse, and then also the availability of guns, and here in the district, illegal guns, because we have really strict gun laws.
When we're talking about gun violence, I mean, in cities across the country, they've had a really hard time trying to curb that type of gun violence. So we know that Washington, D.C., they're tackling gun violence in a similar way to how they tackled the pandemic. What exactly does that mean, and how is it working?
So Mayor Muriel Bowser, she declared a public health emergency in February. And then she created, as you mentioned earlier, an emergency operations center that basically mirrors the city's response to COVID-19. And then the council provided unprecedented funding to support those efforts. And basically, the gun violence prevention director, Linda Harley Harper, is heading those efforts, and she is focusing on 2% of the city's block that account for 41% of crimes involving gunshots. And she's going into those neighborhoods, and she's connecting residents who are at risk of violence. She's connecting them to housing, jobs, drug treatment programs, as well as violence interrupters. And I mean, the goal ultimately is to engage with the small number of people who are involved in dangerous behavior and invest in them and invest in their neighborhood.
And, that's something very similar to, what we saw community outreach programs going into these neighborhoods and telling them about the vaccine, for example. So
That's
some
right.
people still remain skeptical about this initiative. So what else can be done?
Sure. So there are some studies to support aspects of what DC is doing. And so the skeptics might want to look at some of the data that supports what's happening. And in New York City, for example, in 2 neighborhoods that had violence interrupters go in to form relationships with the community, they experienced in one neighborhood in specific, they experienced a 50% drop in gun injuries. But you're right, there are skeptics, and understandably so, people are desperate for a solution. In fact, one resident that I spoke with in a neighborhood that was part of this new Building Blocks program, she said that she gave a tour to the director, and none of the requests that she outlined have been expedited just yet. So whether or not this effort succeeds remains to be seen.
All right, Amanda Michelle Gomez, thank you.
Thank you.